Hi YouTube, this is Wishby. Hi, today is September 15th, and I would say this is my fourth week. So this is week number 4. Um, After weight loss surgery, I had gastric bypass on August 17th. That was a Friday. So yesterday was Friday, and that made it like 4 weeks. So, but on the 17th will be like my official 1 month, which on the 17th, which will be Monday. But beside the point. So I'm 4 weeks out of weight loss surgery, and I'm feeling better. So I guess we'll do numbers, real quick numbers. The date of my surgery, I was 264.5. My highest weight was 282. So as of today, I am 243. So it's a lot of weight loss. So and it, how it's weird that week when I went to the hospital. I was supposed to have surgery on August 15th. So on August 15th I was 271, but because I was doing like liquid diet that whole week, I ended up being like 264, which was like crazy. And then it's been crazy ever since because we're losing like at least 1 pound a day. It's crazy. And at one point it was like 2 pounds a day. So so hopefully that has slowed down. I do have some issues, not medically, just I think mentally, with struggles going through, with struggles with just handling my new stomach, and I think my head hasn't caught up. It's like a hair sticking out. It's weird. Um, my head, like, hasn't caught up with my stomach, and it comes with drinking, with eating. So it's all jumbled up, I think, in my head. So I'm having a difficult time. And of course, I had my doctor's visit on Tuesday, and they were like, "Oh, great, I had like a 27-pound weight loss according to them," and from their numbers, but like the numbers are like all over the place. If I counted, like, from my highest weight, we're talking about like 38 pounds. Not from my highest weight, from like when I started my journey, which was like 282 or 272 or 78, 278. But it's like, it's so crazy, like, because at the beginning of the year I was like 282. So it's I mean, I'm like, right now, this morning I weighed myself, I was 243. That's like crazy, and it's still like a 2 pounds from Tuesday. I had my doctor's appointment on Tuesday, and at my doctor's appointment I was 245, and today's Saturday. It's like two more pounds, and I'm like 243. I mean, I do fluctuate a little bit, and believe me, I have my period right now. So much information, I know, sorry, but you gonna know, like, I am bloated, so it's still crazy. I am worried about having enough nutrition, because like everybody's asking, okay, so when are you gonna go back to normal eating? And I'm like, it's not gonna happen. So, and of course, it was funny. I work at a university, and a lot of times they have events, they have all sorts of things, and my office is like near, like, where they have a big atrium, and at the atrium they always have like tables and food set up. And then one of the professors came. She came with like I don't know, it was like a chocolate something. I don't know if it was a chocolate cake or whatever. And she came, she's like, "Oh, Wisby, there's food downstairs." So she's showing me the chocolate cake. So I had to, like, tell her, look, I had the weight loss surgery, because we usually have like buddies going out to get food. And so I told her, look, I had surgery. There's no way I can eat, any of the stuff. Like, it was. Um, so she was like, oh, and then, I mean, she knew she had people in her family that had it. So she knew, like, what the issues were with that. This hair is, like, really annoying. Where it's, like, sticking. Like, it looks weird. I don't know. I do all sorts of weird things in my head. Doesn't matter. Yeah. So it was funny, and so I mean, there were times, because you work in a university, and you got, I mean, you guys know that if you work in an office. I used to work in law firms, and then the clients would all the time would send like do lunch and they do breakfast, so it would be like big, it's high end stuff, whatever, and it's always food. I mean, I worked as a paralegal, and so there was this one law firm I worked at, and then every night they had dinner, they had catered dinner, and I'm talking about really good food. And so every night, like almost all the secretaries and all the paralegals, well, we used to work overtime, so we'd stay after 7, and you just bring dinner home. And so like, I mean, that whole idea of food, and like when there's things and there's event, there's really nothing I can do, like, to eat. But so there's the whole issue, which is very weird. But in either case, I'm sort of dealing with it. And then, so, I mean, that was my week, besides going to my doctor. Everything was fine. My incisions look good. And then, of course, I really couldn't confess, and I'm going to confess to you guys what happened. So, when on the Tuesday I had my doctor's appointment, I was like, oh, great, I'm going to go to my doctor's appointment. And I realized I was early for my doctor's appointment, and I didn't eat yet that day. So I was like, oh, okay, you know what? Genius. What food is mushy? Taco Bell. Taco Bell wraps, that's really mushy. So I think I could eat the inside of a burrito. So here I go. I go down to Taco Bell and I bought a burrito. It's like one. It's like $2.99. Oh, this is cheap. Maybe I eat a little bit. So I eat. Maybe I took the spoon, and it's very mushy inside. You know. So I took a bite and I took another bite. I'm sure some of you who have been to the surgery will know what happened next. So now this thing is like stuck in my throat, and I'm my doctor's, and I'm talking to the PA, and she's just like, okay, you're doing good, and I'm like, and she's like, you're doing good, great weight loss, then she's concentrating, you must concentrate on protein. 50% of the food that you eat, 50% of it has to be protein, meaning like if I'm drinking, if I'm eating whatever I'm eating, but the percentage of protein must equal 50% of the calorie, like, so it's like, okay, great news. And I'm like, oh my God, I think I'm getting nauseous, I'm getting sick. And so finally, we had the meeting, and she was like, we're gonna check with the doctor and see if he wants to see you. If he doesn't, because we'll see you in 3 months. And then she was like, okay, great. Doctor said everything's fine. They should, we'll see you in 3 months. Perfect. I said bye to the nurses and to the receptionist, and they were like, because they were used to me, and I saw my nutritionist, everything. And all this time I'm like feeling really weird. And I'm like, okay, so this is, I guess, Taco Bell, Mushi. And so by the time I got to the back to the office, which is like about 10 minutes away, I was basically trying to throw this thing up. I'm like, and before, if you seen my videos before, I'm in like experimenting, and nothing's really going now except for really like blended food, and I'm just like, oh my God, so it wasn't even about, I think, the blended, it was just the quality of the food. And it's just that it's Taco Bell is garbage, and my stomach is not having any garbage anymore. And I think that's the lesson in having this type of surgery, which is great about having the surgery, because I'm like, okay, oh, this is mushy food, I can eat it. Mm-mm. Mm-mm. The whole day. I was gagging the whole day. I was try. I and not only did I have the dumping syndrome, it was like, and up and down, and that was done. So I was hoping. I was like, okay, so it went out. It went out the back way. Went out the front way. Maybe I'll feel better after a couple of hours. After a few hours. I mean, it was 11 o'clock at night. I was still gagging. I couldn't even sip. Not even a sip of water. Everything I had was just like water. I mean, my husband had enough, because he was just like, because this is me lying to my husband, and like, oh yeah, I didn't have anything. I just had some like, beans. I still didn't tell him. I'm like, he'll yell at me, because I should know better. And girls, I mean, if you see this video and you like, you get, it's here. I mean, it's here. It's all here. Like, I see the food. I see the commercial. I see I see those things, and I'm like, it's all in my head. My stomach really has please, what stomach? I asked the PA, the physician assistant. I was like, so how big is my stomach? She was like 2 ounces. I'm like 2 ounces. Looks like a baby's stomach is bigger. You know, my son when he was born, he could drink 4 ounces like like this, like nothing. So supposedly stomach is gonna like grow whatever, but I really what they do say about like you eating healthy. And actually I saw this video from this one woman, I forgot her tag name, but she was just like how she did the sleeve and not the bypass. She was like she wished she had done the bypass, because one of the things with the sleeve is that you can eat whatever you want after a while, but with the bypass you really can't. And I'm like, it's like a double-edged sword, because of course I want to make sure like but at the same time, like right now, please, I want, seriously, I want to eat, but I'm not in any way, shape, or form hungry. I'm just want to eat because I've spent the last 30, I don't know what, if I'm 38, so the last 38 years of my life eating, and mostly eating whatever I want, except for the, times when you go on a diet, of course, but, you know, I mean, it's not even, so I mean it's a trial. It in a way it's like it's mental and it's hard, because I'm just like I would like to bite into something, and I know I've talked about this before, but it is to me it's a big deal. And I don't see it like bad, but it's the same way the process is hard. It's like you know ugh. Anyway, but that's been my week, and the weight loss has been successful. Everybody can tell I've lost weight. I mean 243. Wow. I mean, like, close. It's it's constant.